The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in this program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you, the Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing quality outpatient medical care, both in terms of meeting the needs of the Bronx community as well as providing easy access to services.
Yes, Errol, outpatient medical care is extremely important because it provides our community with an opportunity to address a wide range of problems at an earlier and more preventable stage. It also offers the benefit of post-hospital care. Joining us this evening are two experts in the field. Ms. Ileana Lopez is the administrator for the Bronx Care Medical Practice at Tiffany. Dr. Bonicelli is the attending physician in Bronx Lebanon's Department of Family Medicine at Bronx Lebanon Hospital Center.
Now, before we hear from both of you, our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241, and please call us. Now, Ms. Lopez, let me start the program by asking you to share with our viewers, or describe for our viewers, the services that are now available at your Tiffany Medical Practice.
Well, Tiffany Medical Practice now has family medicine, which is Dr. Bonicelli. We also have regular general medicine.
Right.
We have pediatrics. We have GYN. We have GI. And we have Dr. Leggett, which is psychiatry also. And we also have a diabetic educator also on site.
So you have a very broad range of services.
We have a broad range of services.
And what about children versus adults? Do you do both?
We do both. We also, we're reaching out to also adolescents also.
Right.
Because there is a need in the community to service adolescent teenagers also. But we have a huge range of specialty providers also there.
Right.
Dr. Bonicelli, from a medical perspective, what are some of the most serious problems that are now impacting the healthcare of our Bronx community, and how are they being addressed at Tiffany?
The most common medical problem that we address on Tiffany Clinic are chronic conditions, especially hypertension, diabetes, high cholesterol, obesity. We have a group of experts that we are concentrated on treating all these medical problems, not only as a medical problem, but as a whole, understanding the person and all the family members that they can suffer for all these medical
But
problems.
that's a lot of work. How do you see all of the family members?
I'm a family medicine physician. I treat all members of the family, newborn, senior citizen, and we give a comprehensive medical care to the patient. The moment they come in, we're trying to create a relationship with them. In that way, we can build a better communication. In that way, treat it better any medical problem.
Okay.
Now, when people are sick or they have medical needs, how do they get an appointment at Tiffany?
Well, they can either call 99 Bronx, or we have an open door policy that they can walk in at any time. We turn no one away, but 99 Bronx, they can call, and it's available 24 hours. If they need to reach a physician in emergency, they can also.
Well, we're certainly going to go into more detail about that, but how long does it take from the time of call to when an appointment?
Usually the
can get-
call is processed immediately. As soon as they call the facility, if they need to speak to one of the registers, or if they request to speak to myself also,
Right.
the nurse will also triage them over the phone. They can come in immediately. We don't tell them, okay, they have to make an appointment. Depends on what they're calling for.
Right.
They can just
But
walk
when they
in.
do make an appointment, what's the usual time span from the call to the actual appointment?
Actually, it's like the most they stay on the line is 5 or 10 minutes. We
In
get the
terms of
information.
your time, though, to get in for the appointment?
We have same-day appointments available. Same day.
That's excellent.
Yes, and we accommodate also if they say that they're working late. We also make accommodations for them to walk in the evenings also.
Right.
Yes.
Okay.
Expanding a little on Mr. Schneer's question, what are the hours of operation at Tiffany?
Well, our business hours are 8 to 5.
Okay. And can a patient, how long does it take for a patient to make contact with their provider?
Immediately, as soon as they call, they can actually,
That's a provider. I'm talking about their provider.
their provider, if the patient is calling the actual clinic and needs to speak to the provider, if the doctor's seeing a patient at the moment of the phone call, we take the information down, we make sure that the provider calls them back in no less than 20 to half an hour.
I'm going to check you one day
Yes.
Definitely.
because it seems too good to be true.
No, yes, we're
Now,
that good.
where is the Tiffany practice located?
Tiffany is located in 853 Southern Boulevard. It's by Tiffany and Southern Boulevard under the Bruckner Expressway.
Right. And in terms of accessing Tiffany, is it accessible
Yes,
by
we are
transportation?
accessible by MTA. We have the 2, the 5, and the 6 train. The 19 bus and the 21 also pass by where we're at.
And one last question along that line. Does the Tiffany primarily service the entire Bronx community, or is it restricted to
We
a
service
set geographic area?
we service the entire Bronx community.
That's terrific.
Yes.
Mr. Schneer asked this question already, but I'm going to repeat it to make sure that I get the same answer. How does the Tiffany practice respond to walk-ins and individuals that do not have insurance coverage?
That is one.
Walk-ins and insurance.
That is one good thing, because what we're trying now to educate a lot of the people from the community. A lot of people think because they don't have insurance that they can't see a doctor. A lot of them are not aware that they do qualify for certain insurances, and so do their children. We partner with Health First and Fidelis that are HMOs that are at our site. We educate the patient that they can qualify for insurances. We help them with whatever they need, paperwork, whatever other means they need to help them get the insurances that they do need.
Well, this should be a very busy practice.
We are getting there. We are getting there. We're building a good relationship with the community. We're partnering with a lot of organizations in the community. We have an open door policy.
Okay. You want to add to that because she's doing pretty good so far. Too good to be true.
No, that's reality. You know,
Yes.
even with all the doctors, we have a schedule. We always have opening for all the patients that come into our door. Always accepting walk-ins. We never send them back. So that's
Yeah,
reality.
but what about the waiting time? Is that excessive?
Not at all. Usually, the waiting is an average that you can find in any office. About 20 minutes, 30 minutes maximum that the patient will wait, even as a walk-in.
Now, Dr. Bernicelli, when specialized care is needed, what's the process that's followed at Tiffany?
I want to mention that our clinic, BronxCare at Tiffany, is affiliated to the Martin Luther King Jr. So it's a big organization, big network. So anytime that our patient need any referral to see a specialty, it's easy and quick the access for us to get that appointment.
So Bronx Lebanon's specialty services are available, for instance,
Yes.
MRI, radiology,
That's correct.
and what happens? How does that work?
Anytime that the patient need any of these services, we schedule the appointment and we give the appointment to the patient and we follow that. Not only they get the appointment, but we did follow up to make sure that the patient get to see the doctor that is referred and all the tests that we order, I get it done.
If I'm a patient at Tiffany, how often do I see the same provider?
That's our motto. We try that the patient see the same provider anytime. I trying to see my patient all the time. For any reason that I'm not there, always the patient know for the next time will see me. So that's something that we encourage.
Okay, because it's very important.
Yes,
It's very
continuous
important.
care.
Now, what are the types of problems that are typically treated at Tiffany?
We treat all chronic conditions, as I mentioned before, hypertension, diabetes,
Right.
obesity, but also we treat all minor injuries. We do regular checkup, routine physical exam.
Asthma.
Asthma definitely is one of the other medical problems that we address. Trying to avoid that the patient go to the congested ER, we can provide that care for that not urgent or emergency situation that the patient doesn't need to go to emergency. They can come to see us.
Right. Now, how does a patient determine whether they need to go to Tiffany or whether they should go to the emergency room? Because you just mentioned what types of cases should a patient definitely go right to the ER?
Could be the two situations. If the patient call, or we have the nursing staff who are addressing any call, and they are trained to understand what are the situation in that moment. Even if the nurse is not sure of the situation, always there is a doctor available to discuss the situation with the patient and then address. If the patient can come to the clinic or can go to emergency. The other situation, if they come to the office, always is address the situation, and the doctor will make that determination. So it's not taken lightly.
Okay. On that note, let's pause for a short break, and when we return, we will continue our discussion as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx, Lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery and the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at Bronx, Lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of Bronx, Lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And Bronx, Lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now, before we continue our discussion, Dr. Gumbs, I understand we have some calls.
Yes, we have a caller. Renee, you're on the air. You have a question for us?
Hi. I have a question. What is the recommended vaccinations for the 20 to 30-year-old age group?
20 to 30 age group. 20 to 30 vaccinations.
Right now, by that time, all the immunization for adolescents should be done. But there is some immunization that we recommend, depending on the medical problem. For example, if you are a patient with asthma, pneumonia immunization should be up to date. Tdap that contain tetanus, diphtheria, topharina vaccine should be also administered. Flu vaccine, don't forget that any winter, any flu season should be administered. Also, it's important for you to always have a communication with the doctor. There's some medical condition that require other type of vaccination. So
depending on the work environment, maybe the hepatitis B.
Correct.
We may have lost them, right?
Correct.
Yeah, right. Okay.
Do we have another call,
we have
Doctor?
another caller. Thank you, Renee. Sorry we lost you a little bit. David, you're on the air. David?
Yes, Dr. Gum. Thank you for taking my call, sir.
Sure.
My question is how often should I have a physical done? Is it twice a year, and can I get that done at the Tiffany Clinic?
How often should he have a physical?
How old is they?
Does it make a difference? Should at least get it once a year, right?
That's right, but we don't want to make it that lightly, you know. Sometimes it's important for you, depending on if there is any situation, find any routine exam, maybe the doctor will tell you to do more frequently, but once a year is fine.
Okay. Thank you, David. Did you get that? Once a year at least.
And can I, at the clinic, can they take care of that for me, or I need to go to the main hospital?
No, right there at the clinic, we will help you out. This is the right
thank
place.
Thank you so much.
You're welcome.
Thank you very much for the question. Okay,
now, moving to my original subject, the question I wanted to ask each of you is
Yes.
one that we usually ask to our panelists, to share their respective backgrounds with our viewers. In other words, what got you interested in the field and what made you choose the career pathway that you chose? And I'll start with you, Ms. Lopez.
Well, I don't think so much that I chose it. I think it chose me. I started off working for Oxford HMOs first.
Right.
And I was working in the South Bronx. And I really wanted to give back to the community because I see that there was certain needs there and certain things that we could give back to them.
Right.
So just the people, to give back to the people.
Right. Okay, and Dr. Bornicelli, how about yourself?
Yeah, definitely. Even since young age, always was amazed by the science, and medicine was one of them. In my family also, we have many members that are doctors, so I kind of get into the path of other family members. But again, even since I was young, I knew that medicine.
Now, in terms of your educational background, perhaps you can share that, because I'm sure you've gone to a lot of schools to get to where you're at.
Many years, right. I'm native in Colombia. I grew up there. I did my medical school there. Also, I worked there as a general practitioner.
Right.
About 10 years. And then I came to the United States when I did my training on family medicine for 3 years. Since then, I've been working for the Bronx General Hospital. So all my experience as a provider on the United States is being here in the Bronx.
So it's an extensive medical education to get into this type of field.
More than 13 years at least.
Okay. What is the length of time associated with the appointment process? I think we sort of talked about this before, but again, we're trying to see if you're giving the same answer. We're recording everything. How long does it take to get to see a doctor, a provider at your clinic?
20 to 30 minutes, no more than that.
No. If I'm calling from at home.
If you're calling,
Yeah.
we have a walk-ins appointment the same day to see any doctor. Even if you are a patient already at the clinic, definitely you will see your provider. As I mentioned before, we are opening a spot. So
No, I'm a new patient.
New patient?
Yeah.
Same day?
Same. We take a
Same
new
day.
patient, and they will be seen the same day.
So this is a service that really sets you apart from other providers in that you're able to...
We have to, because a lot of people are on certain different kind of schedules, and sometimes they can't come in at a certain time that we would like them to come into.
But what's interesting here is your response rate is so quick.
Yes.
And people can get an appointment
They
almost
can get it
immediately.
the same day. If they said that they can be there in a half an hour, we tell them come right in.
Okay.
If they said they need a physical, we'll accommodate them for the same day.
Suppose they say I can come after work.
Now, we try to be as flexible, but we tell them our grace period is 3:30, but we try to accommodate them to 4:30. Some of our providers even stay a little bit later.
Well, that's good too.
Yes.
Right. Now, another question we ask our panelists is to share their patient success stories with our viewers. And I'm sure you've had many at the Tiffany Medical Practice. And I'll start with you, Ms. Lopez.
Well, my success story is that I had a patient. She had came in with her granddaughter.
Right.
The granddaughter had brought her in forcefully because she didn't want any medical care because she was afraid of getting a bill. She has been in this country, I think it's been like 5 or 6 years already. And with the help of Fidelis, we also assisted the grandmother
Right.
to help her get insurances, because here was this lady, She was going out without medication
Right.
because a lot of our patients, they're on limited funds.
Yeah.
So it's a decision between I pay my bills or I get my medication. She never
Right.
thought that she would qualify for insurance.
So through your work, you were able
Yes,
to get her all
and
that.
as a thank you, she brings us in apple pies.
Wow, that's excellent.
That was the patient's daughter, or
The patient's granddaughter had brought her in because she had
Oh,
she had approached me regarding her grandmother.
Okay, I
Her
see.
grandmother was afraid to apply for insurances.
Right. Now, from a medical perspective, Dr. Buonicelli, what's a patient success story that stands out in your mind, Tiffany?
Now that you mentioned, there is one patient who just came to my mind. He's a young guy, mid-40s, who came to our clinic.
Right.
He was kind of frustrated going to different practice, came to our clinic, came to me. He wasn't a patient who really was reluctant to follow all the medical recommendations, but with time, we gained his trust and our relation built. Finally, he accepted to follow the recommendation, all the medical treatment. Finally, one day I was talking to him. He mentioned about the history of colon cancer in his family, even when he was in the mid-40s, but he's not recommended routine colonoscopy after 50, the recommendation. I said, let's go and do the colonoscopy. It's the history of your family. I refer to the patient to our specialty in gastroenterology.
Right.
Unfortunately, we found a colon cancer. The patient was referred to surgery, all the necessity to be done, surgery, everything is done. He's still on the fight, but that gave me that strength to keep trying to do the job better.
Good. How does laboratory testing and even radiologist services work at the outpatient clinic like Tiffany? Suppose I need blood work or an X-ray of my colon. How is it arranged?
With the lab, we take all the blood sample for any lab in our clinic. So in that way, the patient doesn't have to go to any
So
facility.
he's transported to the hospital.
It's transported
and
from
it comes
our
back
clinic.
electronically.
The result is back to the clinic when when it's posted by the lab.
And the patient, when does the patient get the result?
The patient will be given a result. If there is any abnormal lab, definitely the patient will be called immediately to be informed. Otherwise, the patient, the next appointment that is scheduled, there will be a discussion about the lab.
What about X-rays?
X-ray, we have a radiology facility in our hospital that we can do any test, any radiological test, CT, MRI, X-ray.
At the hospital?
At the
So
hospital.
they're sent to...
We send the patient to our hospital, BronxNet Hospital, for get done any radiological
Who
test.
makes the
We make all the
arrangements?
appointment. The arrangement is done right there in the office, so the patient knows where he's going, what he's gonna get, and when he's gonna get back the result.
Yeah. Now, in terms of your typical day, can you share that with our viewers, Dr. Buonicelli?
Usually I get to the office, I start seeing patient about 8:30. Usually I see patient up to 4:30 all day. That's seeing patient all ages, and that's what I like of family medicine, that I can see all the members of the family in that way, the variety, and that gives me the opportunity to get a better relation with the patient and the family.
Okay. What are the challenges that each of you see ahead, and with the current healthcare environment and so forth? What do you see?
The major challenge, as I mentioned to you, how common is this chronic condition, hypertension, obesity, is change the mentality of the patient about eat healthy, do more physical activity, avoid alcohol, avoid smoking, trying to change that mentality, make the patient follow more the recommendation of the doctor.
What about obesity? You didn't mention that. And you should see a fair amount of obese patients because we have them all over the place.
As you know,
how do you reach them? Do you really make an impact? Because I think that's more important than diabetes and hypertension, because it starts it.
That's correct. Obesity, as you know, is increasing in the United States, adult, but children, something that we didn't see many years ago. So it's something that all the doctors, all the providers, we have it right there in our list to address it as soon as we see it. So any patient, pediatric, adult, who had a problem will be addressed. We have a team, including nutritionists, diabetic educator, provided psychology that we can help the patient with that medical problem.
What impact do you make? Do you make a difference?
That was this patient one time. It's a story, but it's really important because it made the impact.
No problem.
I saw the patient, and the patient come back after a couple of months. She was out of the country for some reason, I don't remember. She came and I noticed. I told her, you lose weight. What are you doing? You know what the patient told me?
You told me.
I doing what you told me, doctor.
Yeah.
You told me eat healthy, eat a small portion, and that's what it gave me where I am right now.
Now, Ms. Lopez, let me
patient
ask you
back.
one
Yes.
quick question about the prevention programs you have in place, particularly as the summer months are coming up and even the beginning of school.
Yes. We've partnered with the PAL. We've also partnered with other organizations, as Dr.
Right.
Gums was saying. How do we address certain issues? We take the diabetic educationer. We've also partnered with a farm upstate, Bronx, Lebanon, and MLK, that we bring fresh produce in the community, which is produce, to the community to educate our patients, because sometimes they think eating healthy is expensive. It's not expensive. So we reach the PAL, we go to the schools, we do education classes, because we're trying to educate not only the adults but the kids.
Right.
To let them know, okay, these are the services that we have an open door policy. These are the classes that we give once a month also, so they can come in, just walk in and participate. You
That's
don't have to
terrific.
be a patient, just walk in and participate.
What services do you have for seniors? Catalog them quickly.
You don't put it like a catalog, but it's the whole comprehensive.
Yeah.
All the referral that can be done. We have a agreement with a community, a senior community center, just close to the clinic, that we address the patient, can be seeing the patient to the center, but labs, nutritionists, diabetic educator, all the
Social
appointment,
worker.
all the appointment.
You all are talking too much.
But on that note, I think you've really given our viewers an excellent overview
Thank
of
you.
what the Tiffany Medical Practice
Thank
is all
you.
about. So let me thank you, Ms. Lopez, and
Thank
you, Dr.
you.
Bonicelli, for joining with Dr. Gums and myself on tonight's HealthBeat television
pleasure.
program.
Thank you.
And most importantly, let me thank you, our viewers, for joining with us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week when we will be beginning a month-long series of women's health issues.
Now the big guy comes off the bat, hitting .342 with 92 RBIs and 36 homers. The first pitch is fouled between
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov. Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.